Good morning and welcome back, Kathy and the crew on 1160 a.m. News Talk Sports. Look for rain a little bit late, thunderstorms this afternoon, moving into thunderstorms this evening, a high of 89 and a low of 64. Don't miss when raw and unfiltered this afternoon until 8 p.m. only on 1160 a.m. KBDT News Talk Sports. And I'm super excited and we're very grateful, and I'm so happy this Facebook Live feed. Can't wait to get her back in studio. Katie, Chris, if you'll please put the number. Somebody's in need right now. They've got that number too. Or please, before I Patty and Steve Williamson, I'm pleading with you, if you're listening right now or if you're on our live feed, share this with somebody that you think might be in trouble. And I'm telling you, the person that might be in trouble may be the last person that would have a problem. But during this COVID, this is such a unique situation. We've never dealt with this before. We're still dealing with the unknown. We don't know when this is going to end. We're just now starting to open the state of Texas back up. So we don't know what comes with that. We're certainly very fortunate that we've got of the Morgan Foundation and Patty Giolot from Something for Kelly Foundation, and our segments for our mental health moment here at JP, Kathy, and the crew every Tuesday. Thank you both so much, and we're very blessed to be part of our radio family and part of the crew. I think that the mental health moment is more than ever. What do you two think?
Kathy, absolutely. We're seeing more and more folks who have been impacted and are going to need help. So we're just thrilled to be on and thrilled to have this time.
Good
Excellent.
morning, Doctor. This is Patty Giolot with Something for Kelly. Could you start telling us about yourself, Timberline, Knolls, history about your credibility and your...
Yes, and thank you all for this opportunity to be you and discuss an important mental health issue in this time of COVID-19. So I thank you for that. Dr. Johnny Williamson, I am a general and child psychiatrist. I practice for about 20 years point. And for the last 5 I've focused primarily on treating women with mood dysregulation, anxiety disorders, and substance use disorders. Currently at Timberline Knolls, I serve as the medical director, which allows me both the ability to provide direct services, direct care, help manage and design unique interventions for these ladies and young girls.
Doctor, you brought up something that is really what we want to focus on for a few minutes, and the concept that eating disorders do not occur in isolation. They often occur with other issues. Talk a bit about your mental health concerns around eating.
Thank you. That's a question and a great. I do think that we very often see, especially in our experience, individuals with eating disorders can suffer from multiple psychiatric, what we call comorbidities. We often see a history of depression, with substance use disorders, as well as eating disorders.
And so, Doctor, if I may interrupt, you're talking about substance abuse disorders. Clarify who might not know what we're talking about.
Yeah, so what we're referring to with substance use disorders would include alcohol, stimulants, any of a substance ways that are unhealthy, maladaptive, and harmful, and often in this see use of those disorders to help moderate mood and trauma and eating.
Would that include medication that, say, for example, Xanax? Somebody who prescribed or has not been prescribed Xanax but is getting a hold using it anyways. Would that substance abuse as well, even though that's a prescription drug?
Absolutely. Substance, we mean any substance, whether it's legal or prescribed. Right. Sometimes those substances some of those substances, benzodiazepines or stimulants, can be helpful in certain disorders used in appropriate ways and maladaptive ways. a substance use disorder.
So, doctor, talking about the mental health concerns, the depression, etc., how do you go about prioritizing issue to deal with first?
And devising a treatment for any individual is getting a clear understanding of what their symptoms are, how they emerge, and how they're connected. And leading edge is usually where we start. And so, briefly, a person who may have a history of trauma, who's dealing with anxiety, substance use, and sometimes they'll come with complaints around substance use disorders. Sometimes they may not even be aware of the disordered eating patterns. Sometimes individuals with disordered eating may come to us for care, and then we come to understand through their history, substances, maybe even maladaptive being used to manage the negative consequences of it. And so it really depends on what the leading edge of their symptom expression at that time, and we devise care to there, build an understanding of these other symptoms and conditions, and then kind of prioritize them based on how they're presenting.
So when you're doing this, when you're trying to understand the leading edge, sometimes people are either willing to share the truth or maybe they're not even of it themselves. How do you go about digging in there to understand the leading edge issue?
A good way to address that is to individual from their perspective, their life story, and then what are the things within care. And starting with that, I think it frees open the conversation. When an individual feels that they're able to themselves fully, without judgment, to an individual who's trying to understand, I think that opens up a world of things that the individual may not be willing to discuss otherwise. And I think another important aspect is sometimes through those relationship encounters, the individual themselves come to understand between these things and the importance of them, and then they share them with us. And then lastly, times because we're in a residential treatment facility and we may have individuals for 30 days, we actually get to see symptoms and behaviors related to other conditions come out ourselves.
Doctor, but how often is this a type thing? Which came first, and which is the exacerbating condition? Is it an underlying trauma that exacerbated almost a genetic predisposition versus the trauma was ultimately the cause?
That's another action and one that isn't easy to answer, and is probably unique to the individual. You often see a patient who begins to use one disorder to try to cope with created by another disorder, and vice versa. And so you may have an eating disorder that has rituals and other food and other ways of managing distressing thoughts about weight. Likewise, trying to manage anxiety related to obsessive thoughts or obsessive images that cope with the distress of the anxiety by restricting their food. And so it is very difficult oftentimes to which is first. A reality that we do see is all of these disorders are disorders that emerge adolescence, and so they're considered mental disorders, and then they get their full expression. And so there's clear connection between them, but the understanding of those can be very difficult to separate.
Doctor, know that our friends in the insurance industry often have a dramatic impact upon how long a patient stays with you. The guidelines they use to treat trauma or depression are very significantly different than the guide they have in place for treating an eating disorder, let's say. How do you walk through complex complications that with an insurance claims adjuster presents to you?
That's a significant challenge. You're exactly right. Oftentimes criteria used to certify or allow a person to access their insurance specific to a diagnosis. So if you take our prior conversation around the fact that most of these individuals have multiple diagnoses, and their presentations can change, especially through the impact of treatment, then who's certified to be treated for depression, we discover that they have significant disordered eating pattern, anxiety, and maybe substance use. So as we address the depression and that improves, I'll see that the drive within them shifts to disorders or eating disorder behavior, and often individuals' policy may not cover substance use or eating disorder. And so conundrum of this is one whole individual dealing with all of these things at the same time, right? But their insurance benefit will allow them access to care for one aspect of it. And certainly we know that without treating the comorbidities, full recovery is really impossible. And so we work really hard to highlight that with our insurance providers. But again, the success with that is very.
Doctor, could you speak a bit about the substance abuse, how different eating disorders, anorexia and bulimia?
Yes, there's a pretty high rate or connection between substance use and these disorders. So it looks like upwards of individuals who have an eating disorder abuse or are dependent on alcohol or illicit substance, and that's in comparison to the general population, which is more in the range of 9%. And then if we take the other side of that in folks who have a substance use disorder, more than 35% of individuals report some form of an eating, and that's compared to a lifetime for the general population of 5%. Big differences and a much higher risk for substance use disorder with eating disorders. Similarly, with substance use, I'm sorry?
No, go ahead.
And just quickly, you see 50 to 66% co-occurrence between trauma and substance use. And in substance or affect, trauma and each sense of aloneness and disconnectedness, and substances can be used for that. And also, unfortunately, many of these individuals are alone in their disorders, and they don't feel like they have human support, and literally be an inanimate, so they don't have to worry about it because they control access to it.
Very good. So in the general population, how does that compare with disorders? Do anorexia differ dramatically from the other disorders?
You know, there's a wide variance there in looking at the specific patterns with substance use. We see ranges of the percent and even higher, and it specific to the individual.
Okay.
Doctor, so how do you treat substance abuse? Of course, the 12-step program is prevalent. Are you dependent on that incorporate other types of recovery programs as well?
We try to create a treatment plan and that is specific to them, and they want to respect their personal values and motivations. So some people, spirituality is very important supports for them, and in those the and can work. We have other individuals with differing motivations and ideas of spirituality. And smart recovery principles is one modality that utilizes that and doesn't rely on that sense of powerlessness, a higher power, and it's a little bit more self-empowering and specific to. And so we try to find commonality and a structured program that respects the values of the
And
employee. I don't
doctor,
think
if you'll
it's a
hold on to that thought,
one-size-fits-all.
we're getting ready to go right now. I think this is super important, especially at one of the latest statistics, at least 55 compared to this time last year. So I think you're on to something. We'll back with more of our mental health moment on JP Cat. All right, and but Facebook Live can still hear you. You know, I mean, if you look at any, you can just type in option during teen. It's unreal, and I've heard this. I need to find it, so I know I'm not fake news, but I'd heard that Texas has now, of course, that we have the highest. Have y'all, any of y'all heard anything like that?
Well, that. Go ahead, doctor.
No, go ahead. I'm sorry.
To the CEO of one of the chain stores, I think it was Costco.
Right.
He was saying that sometimes this information is a little bit skewed because people are consuming things at home that they would have otherwise been consuming at a
when normally you would have gone out to.
That was his argument. Today, I mean, I know we make fun of it, but it's the same with, you know, you're consuming that at home instead of.
I guess so. Or did people just sniper and wash their hands before? That's what worries me. I'm very concerned about that.
You know, I would also add that I think that use of alcohol is high when we have more downtime and less activity and structure. Also, some of the parameters around alcohol use is cost. And people going out into restaurants and bars, everything is a lot more expensive. Now that you don't have access to that same dollar or larger quantity of alcohol, making more alcohol available, which I think
that's
also
a good point. Where you know, you could buy like I know I'll go to a restaurant and I'll be like $9 for a small glass of wine. I could have like a huddle for just a couple of bucks more, and so you're right. So you know, the cost of that, you start looking at cost comparison. Plus, I've seen a meme hand if you've been drunk the 10th of March, and saying in jest, but I know they're not having to drive to work the next day. You know, it said with less structure, kind of like when you go on vacation, you'll let your hair down and have a couple more drinks that you maybe wouldn't have. Even though this isn't vacation time, still your mind doesn't know what to do with the situation we're in.
Right. You know, you hear the term "it's 5 o'clock somewhere." Well, that doesn't apply anymore, does it?
Here in the studio shaking their head. No, that's not a thing anymore.
It's 5 o'clock everywhere. Doctor, when we like to end the show with giving hope. You know, I'm sure towards the end we're going to ask you what you have to people
and this
whose
is
loved ones
this
are
is when we get back. We've got about 30 seconds, but this is a really short segment. But then we'll give you a few minutes with our audience afterward.
Okay,
and yeah, Chris, I had heard the same thing.
And I was just going to throw in, similar to the alcohol, I think we see changes in eating patterns as well. So
Yes.
boredom, a lot of times we'll eat, we'll do a lot of things that we wouldn't do otherwise.
Right.
Yeah, that's a good point. It's not structured.
Yeah, and Chris, pornography is going up too. Like ever had?
How would
Or
Chris
going through
Gass
the-
know?
She's a professional. It's her to know that stuff. It's her job. Good back to JP, Kathy, and the crew on 1160 AM BT News Talk Sports. Look for partly sunny until we get some thunderstorms to the evening, headed towards a high of 8, a low of 64. Classic radio of the past. Don't miss Classic Radio Theater with tonight from 8 until 11 p.m. only. MBT News Patty and Steve, we're so excited that y'all have produced such a great segment today with Dr. Williams. I'm going to turn the show back over to y'all because I know we always like to talk how we can give the crew hope, and especially that one person who this radio show might what can we tell them to get them some
So, Kathy, we always like to end our show with some upbeat. Dr. Williamson, talk a little bit about where people can hope, how they can connect with your organization.
Well, first thing I'd like, and I think the most important thing we can talk about today is, though the facts about eating disorder, the good news is it's very clear to show that up to 80% of people who even complete treatment recover significantly. And so I think in the room and in this discussion is to seek out and seek support, access treatment, and if you persist, you can certainly experience a very significant improvement in your life, and recovery is absolutely possible. In reaching out and connecting with us at Timberline Knolls, you can go to Timberline.com. That's our website. You can also call us at 993-6612. We have people staffing those phones 24/7. I'll be there for you. So please, if you someone who could benefit from this type of please connect.
Doctor, so what three things a parent can look for in their kids? The initial red flag be concerned about to get intervention before things progress too far.
You know, that we can look for. That's why it can make it hard to detect disorders, but changes in mood, problems with focus, withdrawal, or other family members seeming apathetic, especially if they express any kind of body image concerns, and then physically looking for loss, significant body change in female menstrual period, and issues related to any kind of ritualistic or unusual food intake, looking at self in the mirror, exercise, that's not well-baggy clothing. Often individuals who are undergoing a body change with regard to this will clothing, largely because it interferes with that whole piece, but also it what's happening with them physically. And I think the biggest thing here is you don't have to know. If you see something unusual or different, engage, talk, discuss, and that's how you figure it out.
And of course that should to all apply to school friends. Let's say when again this next fall, what advice would you give to school if they have concerns about someone who they think may be having depression or trauma or eating disorders? What advice would you give to them?
I think the most important thing is to reach out to a responsible, hopefully adult, who you can trust, who you know will be helpful. I think that talking with them will be helpful as well, but sometimes it's important to enlist the support of the individual. And I think when it comes to school, that's an important thing, because about disordered eating, body image, and there are a lot of things that are coming to our adolescents. And so I need to push back against that. And the biggest thing, if you have a question or concern, principal person that you trust, and ask them.
Very, very important, Doctor.
Excellent advice. So much. Patty and Steve, as always, they can't wait to have y'all back in studio. Hope that'll be soon. And thank you, Dr. Williams.
Yes.
Oh, thank you for having me.
Thank you for joining us. Very good information.
Excellent information. And thank you so much to Chris, again, Acadia. And if you need help, she has got the phone number on page right now, and I'm going to get you that phone number as well. That's 6900-7499. 469-400-7499. There are people who are ready to help. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 469-400-7499. 4 or you know someone who needs help, please don't hesitate. Out as soon as we end this broadcast, reach out right away. We're 11:60 a.m. News Talk Sports, and we're JP, Kathy, and the crew, and we'll talk to you tomorrow. All right, and Doctor, we've got a few more minutes, so Patty and Steve, wrap it up for our the crew who's listening on Facebook.
One last thing, and I know I forgot up yesterday, but it just kind of popped in my head when you mentioned the spirituality. Are you beginning to see a rise in the people who come to you? They have some roots to hold on to in terms of their faith and spirituality.
Oh, that's a great question.
Do you incorporate that in the treatment program up there in some way?
Absolutely. I think that's a great point to point out. Most of our individuals have some level of spirituality that is a firm base, right? And for some individuals, that a religious base for that. And at Timberline, we have what's called the Grace Program, which highlights their connection with the higher power process. And then we have individuals who have non-religious based sense of humanness and spirituality rely on that is a source of support with their wider environment. And so learning and teasing apart those values in that individual, highlight them and respect them in our plan of their care. How we help them for change, how we help them pursue their environment, and how we also help them see themselves as a whole, unique, intact individual, physically, emotionally, and spiritually.
Very good. And to give you guys a last shout out here, if I understand, give out some scholarships to high school kids last year.
Oh, wow.
Can you go into that a little bit?
I am not personally connected. I know that we all individuals who are seeking support and care and can't access it otherwise. So aware that Timberline has done that throughout the years, though that's the program. I'm sorry, I'm not specifically aware of.
Okay, because I know I read that. I think it was last year you gave out $4,500 scholarships to kids. I think in the Vermont high school who expressed an interest going into counseling or something like that in their career. So just wanted to tip to you guys for that and to being so proactive with community. I know that my daughter came up to TK twice, and was a good experience for us up there. So thank you guys for that. And any last words to moms or dads out who almost had a loss right now? What last advice could you give to them?
An important thing is to try to seek to as a parent myself, there are encounter with my children, and I'm not sure what to make of it. So engagement. No, don't assume it's okay, and the aim is to remain, express your love and care for them, and in that environment, I think it gives us the to understand them from their perspective and their experience, and from that we can decide what our need to be.
Well, Doctor, we should have this segment pulled up hopefully this afternoon and put up on. We'll make sure you get you and Chris Getz, of course, will give that. And Doctor, we thank you so much for your time. You were just a great guest.
Yes, fantastic. Thank you, Doctor.
Thank you for joining us.
Thank you all for having me. I think this is a topic, and it's a great opportunity to share this with the wider community. So thanks again.
Absolutely.
You betcha.
Steve, next week, do y'all have a priority to produce that?
Well, we have the guest we had she is not going to be able, so I'm scrambling around a bit, but we should have somebody. I should have somebody no later than this afternoon, and continue on. And I do know one segment next. We are having the overall. He's the medical director, and I believe an attorney as well. The overall person for Acadia Health.
Fantastic. Oh, that's great. See, we need people to come in studio again. I miss y'all. But thank y'all with us under circumstances.
Gotcha. All right, guys.
Love y'all.
Thanks. Everybody have a blessed day.
Bye. We will see y'all
Thank
tomorrow.
you all. Be safe.
Thank you. You too. All right. Thank y'all for celebrating Christy's birthday. Woo!
Thank you so much.
There you go. She's getting ready to go partying now.
Woo-hoo.
Chris, way to go. Way to go. All right. Love y'all. We will see y'all tomorrow. We'll have Dr. Good. We'll have an education segment for us. And I think JP has another guest. I'm not sure who he has. Somebody else is coming. Anyways, and hopefully JP will be back in studio, feeling better from his migraine. So talk to you soon. Love y'all. Be healthy and safe.